South Africa is among countries with a critical shortage of organ donors, but the country has been lauded for its legislative and material interventions in addressing the problem, particularly in the provision of dialysis care for people with kidney complications. Dr. Elmi Muller, head of Groote Schuur Hospital Transplant Unit, spoke to us earlier on her recent study into HIV/AIDS organ donation programs. We began by asking her how serious the shortage of organs donated among HIV and AIDS people is.
Well, we have a huge problem with the amount of organ donors in South Africa that becomes available to people with organ failure. And that is in both categories: patients who are waiting for organs who have HIV disease, and patients who are waiting for organs who have not got HIV disease. And we, as people who are working in the field of organ donation, are constantly trying to engage the public to become organ donors, because we have so many people on the waiting list waiting for either kidneys, liver, heart, pancreas. All those organs are transplantable organs, which, if we have the right donor, we can use for recipients on the waiting list. In South Africa, we have the largest group of patients who've got organ failure plus HIV. And that made us the ideal place to study a combination of HIV and organ transplantation. So the reason why I drove this project was because when I started, patients with HIV who had kidney failure were not qualifying for dialysis in the state sector. And this was one way to help those patients who otherwise would have died if they didn't get organs. Now, I worked very hard to get this research project going, and over the last 5 to 7 years, I have been transplanting patients with HIV positive donors. And this has seriously made a difference to the waiting list in South Africa, but it also has got an impact on the rest of the world, where they now want to start using the same donors. So if you look at the USA, they've adopted what they call the HOPE Act, and that is where they also now want to use HIV positive donors for HIV positive recipients. So yes, it has been a research and a personal research interest of mine, and the reason why I'm doing it is because we have such a large number of HIV positive patients in the country who are waiting for organs.
You touched on a very topical issue of dialysis and the suitability. What is the scenario now? Who qualifies for dialysis, who does not qualify, and what do you do if they do not qualify?
We are working as the medical community very hard to try and increase the amount of dialysis that is available to patients in South Africa. However, if you look at the constrained resources, especially for patients in the state sector, this remains a huge problem. And it means that we cannot accommodate everybody who gets renal failure onto dialysis. So part of it is about education and telling people how to prevent to get renal failure. Part of it is to expand the resources, especially in the state sector in South Africa, to give more people the option for dialysis. And I'm happy to say we are working around this with the government and with the Department of Health to try and increase this. And part of it is to take patients who are on dialysis back off the waiting list by giving them a transplant. So it is true that there are a lot of patients who do not qualify for dialysis, but we're working on all three these levels to try and increase those dialysis slots that are available to patients.
But it would then be ideal to say at this stage that the plans that government has put in place so far actually seek to alleviate the problem and actually sort out the problem of dialysis?
Yes, I think the government is very interested to solve this problem, and we actually had a very positive meeting with the Department of Health in April of this year, and I do think they want to move forward to increase dialysis and to increase the treatment options for patients with end-stage renal failure. But at the moment, it's just not simply enough yet.
As compared to receiving an organ transplant, a kidney in this particular case, what is the survival rate between those who stay on dialysis and those who receive a kidney?
So that is a very interesting question. The dialysis patients generally do not do as well as the patients with a transplant. The transplanted patients have a better quality of life. And when you look at HIV positive patients in particular, those patients who get transplants get a much nicer curve on their CD4 count. They have a much higher CD4 count. They tend to have much better control over their general health and well-being. So if you compare the two groups and you think about dialysis versus transplantation, there's no doubt that transplantation is the better option. There's another thing to think of, and that is that dialysis is really expensive. The patient needs to go for dialysis 3 times a week. They often need to spend 3 to 4 hours in the dialysis unit. In that time, they need to be connected to very expensive machines. They need expensive vascular access to keep them on dialysis. And if you look at transplantation as the counter option, it's much more cost effective with a better quality of life.
And the survival rate among those who are HIV positive?
Well, at the moment, it's far over 95% with transplant. And on dialysis, it is a bit less. We're looking at about 85 to 90% survival rate for 5 years with dialysis. Generally, we talk about survival rates, 1 year survival rate, a 5-year survival rate, a 10-year survival rate. So in my own study, the 5-year survival rates are almost 90%. And if you look at the USA, where they've been using HIV negative organs for HIV positive recipients, their survival rates are almost sort of 90-91%.
I think when one is dealing with organ donation, you are faced with some serious stereotypes. The main challenges that you are facing as the medical fraternity, what are those and how are you navigating your way through them?
So there are different barriers why people do not want to donate their organs. Generally, our problem is by getting enough donors. There are people who simply have not been educated and they do not understand what it is. So we confront them at a time when a family or a loved one has died, and it's generally quite difficult for them to make a decision that they will donate the organs if it's the first time they hear about it. And I think that's the most important thing for us as medical professionals, to try and educate the public about what it is, what organ donation is, and to also reassure them that this is not something terrible. It's not us coming as vultures and taking out their organs. It's generally an operation which is very well controlled, which is done by a surgeon, where we take out all the vital organs and we close the body very nicely, so that you cannot see that those organs have been, removed. So, you know, the public sometimes think that it will be a very disfigurative procedure, but it's not. At the end of an organ donation procedure, the person looks exactly like before, except for a long scar, which we normally put the dressing over. It looks very similar to somebody who had a laparotomy or an operation before death. So that's the first barrier. The second barrier, I think, is a cultural barrier. So some people have got conflicting cultural advice, and they are not quite sure whether organ donation can be or cannot be part of their culture. And I think once again it's important for us as medical professionals to actually talk to cultural leaders to get a better feel for what these concerns are that some people in the public have, and to also educate better in terms of what we do, so that we can see whether there's a common ground that works for both sides. And then I think there's a third issue, and that's religious issues. Some people are not sure whether their religion support organ donation. And once again, as professionals who work in the field, we do now a lot of work with different religions to make sure that they are happy to support organ donation, and that is with all the different religions that are being practiced in South Africa.
Because some people think that if they gave their arm off and the trumpet rang, they would wake up with one arm off. That must be the challenge.
That's correct, yes. Some people worry about those things.
Any incentives for potential donors that other countries are using as a model that can encourage ordinary South Africans to donate organs?
Well, at the moment, we see organ donation as a goodwill thing, something we do in the society to create a better community. We want to create a vibe of giving. We do not feel that you can actually give somebody money to compensate for organs, especially after death. It's a slippery slope when it becomes a market system. So generally, as professional people in the field, we think the best is that it remains a gift, and it's often called a gift of life, and such an important gift that people can give to somebody else who's got organ failure. And in this bigger community of South Africa, where we're working towards common objectives and making South Africa a better place, giving an organ is a wonderful gift that shows that you care about the people around you, about your country, and about the bigger picture. So that is where most people all over the world are at the moment, and generally we're not moving towards a market-driven system.
Do you think that there is a new approach necessary to invite as many people as necessary to donate organs, and something could be done differently?
Of course, you should always look critically at your practice. We as professional people who work in the field should always look critically at ourselves. Do we reach enough people? Are the methods that we are using correct? Do we need to do more education? Do we need to do more media work? And of course, those questions are obviously asked all the time to us and in our own community. If you ask me personally, I think we have to have education at a very young level. We need to perhaps drive those educational systems at schools and at universities to help young people to understand what organ donation is about before they get confronted with the reality of it, so that they understand the theory. Yes. And that they also know what the advantages will be for themselves if they would suddenly get organ failure, because it can happen to anybody, any color, any race, any age. Any of us can get a problem tomorrow, and we don't know what the future holds for us.